Hello friends, I'm Dr. Amit Goel, Senior Consultant Urology, Uro-Oncology and Kidney Transplant Surgery. Urinary tract infection is the infection of the urinary tract, which means it might involve the urinary bladder or sometimes the kidneys, where these are infected by the microorganisms. That means the bacteria as the most common positive agent. The incidence is really very high, and this usually happens in the females, but it can happen in the males as well. Now, coming to the symptoms of a urinary tract infection. So the patient complains of pain or burning while they pass urine. There might be a repeated urge to go to pass urine. After passing urine, the patient might complain that they are having a feeling that the bladder has not emptied properly, and they have a repeated urge to go and pass urine. Now, if there is an infection that ascends from the bladder up to the kidney, these are the patients which we call as complicated urinary tract infection, and these patients usually presents with fever and flank pain because the kidneys are situated here. Patients also complain of some blood in urine, or there might be some pus in urine. What are the risk factors that predispose us to the urinary tract infection? First and foremost is the female as a gender is a multifold predisposition to the urinary tract infection, and the reason being the length of the urethra that the females have is much shorter than what the males have, and these usually are ascending infections, so females are always too much predisposed to urinary tract infection. Other factors are diabetes, obesity, sexual intercourse. We see a lot of newly married females having infection in the bladder, and this is known as honeymoon cystitis. These are the patients after the sexual intercourse, they acquire a urinary tract infection. Anything that causes the inability to pass the urine completely from the bladder can also predispose the patients to acquiring urinary tract infection. To get the diagnosis of a urinary tract infection, any patient who has some symptoms of urinary infection, these are the patients who should undergo a urine routine and a microscopic examination, and also the urinary culture examination, just to see what is the bacteria or the bug that is infecting the patient. And this urine culture should typically be the midstream clean catch. That means this center part of the urine that once you pass urine, so it should be a midstream clean catch urine that the patient should be collecting and giving it for examination for the best results. Coming to the treatment, usually the urinary tract infections are non-complicated. That means they're just involving the bladder, and we call it as non-complicated infections where they're not involving the kidneys. Appropriate antibiotics in the form of tablets, that means the oral tablets, they help the patient get rid of the infections. But if there are certain infections where oral antibiotics are not giving the sensitivity pattern, these are the patients who should receive injectable antibiotic few days, and these infections can be very well treated. Coming to the prevention of urinary tract infection, first is the patient who's having the urinary tract infection, or for anybody in general public, should be drinking plenty of fluids, and then any person who's we usually have to use public toilets a lot of times. So when we are using the public toilets, we should be cleaning the seat with some sort of a napkin or something, and then only we should be using the toilets. Especially this goes on especially for the females. And the females also can use a half-sitting posture to pass urine rather than fully sitting and acquiring the infection from somebody else. Sexual intercourse is one of the predisposing factor for the urinary infection. If the females go and pass urine after having the intercourse, or before going to sleep, this helps a long way to having infections, not acquiring urinary tract infections. Then, of course, the personal hygiene of the perineum, that means the area where the urinary external passage is, that should be taken care of while cleaning. The patients who are diabetic, these are the patients who should be controlling diabetes very well. In the males, any symptom that the patient had that they're not able to pass urine properly, these should not be ignored, and they should be consulting doctor to check out what is the problem, why they're not able to pass urine, because any obstruction to the flow of urine definitely predisposes the patient to recurrent urinary tract infections. Thank you.
Subscribe to our channel for more updates.
अपने पेशेंट्स, फ्रेंड्स या रिलेटिव्स के साथ जरूर शेयर करें जिनको यूरिनरी स्टोमा, इलियोस्टमी या कोलोस्टमी है, ताकि उन्हें स्टोमा केयर में आसानी हो।